The governor right now, he's coming out to brief us, so why don't we take a break here and we'll hear what he has to say. With states around us, including New Hampshire, canceling school, there's probably a lot of pressure in that area. Let's see what the governor has to say.
So good evening, everyone. We have a number of announcements to get through, but I want to start with a few rumors. We are not planning any forced shelter-in-place orders. Everyone needs to get their news from legitimate places, not from their friend's 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 friend. Please check mass.gov/COVID-19 for all updates. Our state and local health officials are monitoring this issue around the clock and working hard to provide new resources and support to our residents. I want to take a minute to go over what the science tells us about this disease. For the vast majority of people, approximately 80% of the population, coronavirus would mostly feel like the flu. The infection would not lead to hospitalization. Your body fights the infection and recovers. But the reason we're taking this so seriously is because it is incredibly contagious. It's more contagious than the seasonal flu. There will be more cases of COVID-19, but we also know that if we take decisive steps now and everyone plays their part by following the best medical guidance, we can slow down the spread. And our healthcare system can be better positioned to care for the people who need it. Tomorrow and Tuesday, only emergency executive branch workers will report in, plus those who are designated by their manager to be critical to our response to COVID-19. Managers will be notifying those employees tonight. During this period, we will work to expand alternative work arrangements for the executive branch workforce and further develop plans to continue to provide the essential government services people expect. We've been working around the clock on several provisions, emergency actions to respond to COVID-19. Today, we are ordering all commercial health insurance carriers to allow providers to deliver services via telehealth. This allows people to avoid physically going anywhere should they need to consult a medical professional. Secretary Sutters will say more on this later. We will also be directing hospitals to postpone elective surgeries to ensure medical workers in hospital space is available. We will be prohibiting long-term care facilities and nursing homes from allowing any visitors and require hospitals to screen visitors and restrict visitation. The Registry of Motor Vehicles will extend the renewal timeline for certain credentials to reduce the need for customers to physically visit an RMV service center for in-person transactions. We will be relaxing some of the requirements around current unemployment claims. This will allow many of the workers who are affected by closures to get some financial relief faster. We will file emergency legislation that will allow new claims to be paid more quickly by waiving the one-week waiting period for unemployment benefits that currently exists under state law. We will also file emergency regulations expanding the eligibility around collecting unemployment for people who've been impacted by COVID-19. We will also file a legislative package to help address challenges surrounding the municipal governance issues that have been raised by many cities and towns, including potential delays in holding town meetings and adopting fiscal year 2021 municipal budgets. We announced last week that the Boston Marathon would be postponed until September 14, 2020, and will file legislation tomorrow to make that official. All of this will be filed tomorrow when the legislature is open. Most of you know that last week we issued guidance prohibiting large gatherings of 250 people or more. Today we're amending that guidance under our emergency powers to prohibit gatherings of over 25 people. Subject to this order, these gatherings include all community, civic, public, leisure, faith-based events, sporting events with spectators, concerts, conventions, and any similar event or activity that brings together 25 or more people in a single room or a single space at the same time. This includes venues like fitness centers, private clubs, and theaters. With respect to restaurants, I am ordering that any restaurant, bar, or establishment that offers food or drink shall not permit on-premises consumption. These establishments may continue to offer food for takeout and for delivery. Establishments must also follow the social distancing protocols set forth in the Department of Public Health guidance. This order is effective Tuesday, March 17, 2020, and shall remain in effect through April 17, 2020. I want to be clear, this order doesn't apply to grocery stores or pharmacies. This is about bars and restaurants and those places that people do not absolutely have to go. I realize these measures are unprecedented, but we're asking our residents to take a deep breath and understand the rationale behind this guidance. As we said yesterday, grocery stores are getting restocked. The reason we're seeing bare shelves on the news and when we shop is because people are stocking up a little overboard. Just remember that if you buy 2 years of canned soup, that just means your neighbor may have to go without. For responsible planning advice, visit mass.gov/no-plan-prepare. Now, given the involving data regarding cases of COVID-19, and out of abundance of caution for the health and safety of children and school staff, I'm ordering a 3-week suspension of school operations for educational purposes at all public and private elementary and secondary schools. This will be effective starting this Tuesday and continues until April 7th. That means unless your district isn't already closed, school is on tomorrow, but not Tuesday. We understand that many districts rely on school buildings for essential services outside of educational programs, like meal programs and special education. Closing down school for classes will not impact these types of services, and we will work with school districts to keep buildings open whenever possible to continue to offer these services. Although schools must suspend in-person educational operations, staff should be planning for how to equitably provide alternative access to learning opportunities during this period and potentially beyond. Equally important, school personnel should develop plans for ensuring to the greatest extent possible that families have access to essential non-academic services for their children, especially involving special ed and food services for students who are the most vulnerable. As you know, many school districts have already announced they will suspend classes for a couple of weeks or more. It's important that we all take a couple of minutes to think about why dispersing classes and school gatherings is necessary to help us mitigate the spread of COVID-19. Our public health officials have made clear COVID-19 will feel like the flu for the vast majority of the people who get it, but it's highly contagious. By breaking up large gatherings and encouraging social distancing, we can prevent the spread. But we can't simply transfer a group full of kids from their classroom to your neighbor's playroom for days on end. We will not be doing our part to prevent the spread if there are a ton of kids hanging out, playing video games, and sharing snacks every day from one house to the next. We're urging parents and caretakers to use the next 3 weeks to truly practice social distancing. This means maintaining a safe separation of at least 6 feet from others. This means no free-for-all play dates and more time at home with only immediate family for the next 3 weeks. The Department of Elementary and Secondary Education will work in partnership with schools and districts to develop strategies to sustain learning and vital services throughout this period. DESE has already received a partial waiver from the U.S. Department of Agriculture, providing greater flexibility regarding food service in certain districts with higher concentrations of low-income students, and is actively pursuing additional waivers for the remaining schools and districts. The suspension of educational operations at K-12 schools will inevitably affect the provision of preschool and childcare services. Although we are not ordering the closure of childcare programs at this time, we are strongly urging childcare providers to strictly observe guidelines that are being issued by the Department of Early Education and Care and the Department of Public Health, which call for temporary closures based on actual or indirect exposure to individuals with COVID-19. This order does not apply to residential schools for special needs students or other group homes. At the same time, EEC will prioritize the maintenance and expansion of childcare capacity serving frontline healthcare workers and first responders across the state. With regard to higher education, the Department of Higher Education and DPH strongly recommend that colleges and universities, both public and private, continue to pursue strategies to reduce the need for students to be on campus and shift to remote learning to allow students to successfully complete courses. Yesterday, as you may know, we also announced that we're standing up a coronavirus command center. This team of experts will work on pushing back against this disease and focus on expanding testing capacity and distribution and quickly responding to the needs of our communities. Expert teams will plan to expand lab capacity for testing, plan quarantine operations, coordinate communication and distribute guidance across government, respond to the needs of our local boards of health, monitor supply chains, and identify surge capacity in our healthcare network. On a final note, I want to remind everyone that in addition to the role we all have to play in pushing back against this virus, there are other things we can do. Call your neighbors, your friends, and your families. A friendly check-in can go a long way right now to helping someone through their day. And as a final reminder, you can always visit mass.gov/COVID-19 or call 211 for the latest information. And visit mass.gov/no-plan-prepare for helpful advice on planning for emergencies. With that, I want to turn the podium over to Secretary Mary Lou Sudders.
Good evening. As you know, on March 10th, the governor declared a state of emergency in the Commonwealth to respond to the spread of COVID-19. Under that authority, today, 5 new public health orders are issued. The first order immediately expands access to telehealth while we mitigate risk during the COVID-19 outbreak. The order requires all commercial insurers and the Group Insurance Commission to cover medically necessary telehealth services in the same manner and to pay the same rate as in-person services. Additionally, the order prohibits cost sharing and prior authorization for telehealth services for the treatment of COVID-19. Telemedicine is one of the most important things we need to divert care from hospitals and ambulatory sites for patients. By enabling patients to remain at home, rapid treatment delivery can be provided. We can adhere to social distancing protocols. We can optimize efficiency and conserve resources. The second order is that all assisted living facilities, nursing facilities, and rest homes are to ban visitors to protect the health of residents and staff, and obviously there's exceptions for end-of-life and hospice care. This is consistent with federal guidelines issued on Friday by CMS that bans visitors to nursing homes. The third order requires that all hospitals that are operated by or licensed by the Department of Public Health and/or the Department of Mental Health must screen all visitors and may restrict visitation or limit the number of visitors. A fourth ban is that beginning Wednesday, hospitals and licensed ambulatory surgical centers must cancel non-essential elective procedures in accordance with DPH guidance, which will be published either late today or tomorrow. This is to ensure that medical supplies and resources are available for treatment of individuals with COVID-19 should they require medical attention or hospitalization. It also further conserves personal protective equipment such as masks, gowns, and gloves for use by healthcare professionals. And the fifth order allows certain pharmacists to make hand sanitizer to address the shortage of hand sanitizer in the Commonwealth. I just want to remind residents of the Commonwealth, if you have questions, to please call 211. More than 1,600 calls have now been made since it went live. Standing up this line has greatly reduced non-urgent calls to the state's epi line, clearing that line for clinical consultations. And with that, I'd like to turn it over to Commissioner Burrell.
Thank you, Secretary. Good evening. I'd like to now share with you our latest COVID-19 case counts and some other data related to testing of COVID-19 in Massachusetts. Today, we announced a total of 164 cases in our state. That is up from 138 yesterday. We are going to see more cases in Massachusetts. Our goal now is to decrease the impact of COVID-19 in the Commonwealth. As we announced earlier today, 799 patients have been tested by our Massachusetts State Public Health Laboratory, up from 475 people tested yesterday. With the new system we have put in place with federal approvals, we will be doing more testing on more people, which has been our goal from the start. With the new CDC guidance on clinical testing protocols, clinicians are required to only submit one nasal swab, rather than the previous requirement to submit both nasal and throat swabs. With this change in clinical testing protocol, the state lab's testing capacity will increase to approximately 400 patients a day, up from the current 200 patients a day. With national labs now being approved by the FDA to conduct testing, clinicians can submit specimens for testing directly to these labs. We are now seeing these labs come online and begin to report results. As of today, we have been notified of 7 new cases identified by testing through these labs. We are also beginning to see hospitals being able to test, and this is good news. With more clinical labs in Massachusetts working to get FDA approval, even more capacity will be coming online soon. And we have received at least 170 specimen results from these labs, bringing our total tested to at least 969. To speed the testing process for all of these facilities, Massachusetts clinicians now have more flexibility to determine which patients should be tested without having to call our Department of Public Health epidemiology line. All of these changes will enable more people to be tested and for more tests to be conducted. We had previously informed you about community-level transmission of unknown origin in Berkshire County. Today's data suggest community-level transmission of unknown origin in 7 counties in Massachusetts. These include Berkshire, Essex, Hampden, Norfolk, Middlesex, Suffolk, and Worcester. As you have heard, this is an evolving situation. I speak to you as a physician, your Commissioner of Public Health, and as a member of my own community. Please take seriously the social distancing measures that you heard the Governor speak about. Social distancing is our collective opportunity to influence the course of this illness and flatten the curve. Each of us needs to do our part. We help our neighbors and our friends and our families when we do our part. Let's take care of each other, and we will get through this together.
Questions?
Governor, when you appeared on the work session this morning on Channel 5, you went to the schools, you had said up until now it would allow the individual districts and municipalities to make their own decisions, and you had said your decisions were based on the facts and on the data. I'm curious what facts or data you've received in the past 7 hours that changed your mind.
Well, I would argue that the paraphrase of what I said is not quite right. I think what I said was that the Department of Public Health and the CDC had both issued guidelines with respect to when it made sense for schools or school districts to make decisions about closure. And depending upon the nature of what those facts were on the ground, that closure could be for a couple days or for a couple of weeks or 5 to 8 weeks, depending upon what it was. As the Commissioner just pointed out, the facts on the ground have changed. Now that we have evidence, based on the testing results we have, that we have community transmission, 7 communities, seven counties in Massachusetts. I think at this point in time, it's particularly appropriate that we not only move on the school closures, but also that we get a lot more aggressive around other places and spaces that people gather, which is why we dropped the gathering limit for social gatherings from 250 down to 25, and why we put an order in place to dramatically restrict access to restaurants and bars.
Governor Baker, what about retail stores? We saw restaurants and bars, if they're open, people are going to go into them. What about retail stores?
Retail stores under this proposal, as long as they have 25 people or less in them, are able to stay open.
Governor, does this supersede Boston Mayor Marty Walsh's orders today? He was talking about lowering capacity
Yeah.
of restaurants. And in terms of schools, I know Boston School is supposed to be closed for 6 weeks. Does this take it back to 3, or how does this affect his, press conference today?
2 things. One, I think one of the things the mayor said in his press conference was that they were going to work pretty hard to make sure that establishments that serve food for purchase would be able to participate on a takeout basis. That was one of the recommendations that his folks made. Under this guidance that we're offering, this order we're putting forward, if you are in fact in the takeout business, you can stay in the takeout business. If you're not in the takeout business, you can get into the takeout business. What was the second part of that?
Well, so for that, does that mean that you can't actually sit inside a restaurant?
Correct.
Okay, including the city of Boston, no matter what.
Correct.
He had tried to just lower the capacity.
Yep.
But this means nobody can sit.
Correct.
on it.
The other thing you mentioned was,
Schools.
I forgot again. Oh, locals can go beyond what we're proposing. We're basically saying we think Tuesday tomorrow, Tuesday the day after tomorrow till April 7th. That's a 3-week pause. Yes.
But you could go beyond that if you want.
Well, obviously, we're going to make our decisions about some of that stuff based on the facts as they become available. But I want to reemphasize this notion that if everybody treats this as a 3-week summer vacation early, that's not going to help us with respect to the issue we're trying to deal with here, which is to reduce community spread and transmission. People need to take seriously this idea of social distancing and try and spend as much of this time as they possibly can at home.
Did you see any of the footage from South Boston yesterday at that?
Yeah, sure. Yeah, and I was, as I said this morning, I was glad the mayor made the decision to shut down the bars last night. I was glad they weren't open today, and as I said during my remarks this morning, I was hoping that they would be closed on Tuesday. That's exactly the kind of thing that makes what is already a very challenging problem significantly worse.
Are you making any?
And the other thing I just want to say about this one, we have all said many times that young people in particular, in many ways, are the folks who are least likely to be profoundly affected by this. And that is a good thing, okay? But the thing everybody needs to remember, especially if you're a young person, is your contact, your physical closeness, your contact with older people, and especially with folks like your grandmother or your grandfather, can put them in terrible trouble if you are not showing a heck of a lot of symptoms, not necessarily even knowing you've been infected, and carrying that very contagious virus around with you. And I think it's important that young people appreciate and understand that with respect to this, it's not just about them.
Are you considering any changes at Logan Airport with the MBTA? Obviously, more than 25 people on a subway train.
We've been talking to the T about what the appropriate procedures for them going forward will look like. There are a bunch of things, not just relating to folks on maximums on cars and trains, but also schedules and work. You know, the nature of work and the way work for the folks who currently work there should be organized going forward. That's another thing that's under review.
Governor Baker, why stray away from either a citywide or statewide lockdown if they're already urging people not to go into restaurants and to go to school?
I'm not sure I know what you mean, Tiffany.
So if you're urging people saying that this is very contagious,
Yep.
why why not just enforce a statewide lockdown? Because we're hearing from some medical professionals that are saying that that might be a good idea, just to encourage everybody to stay home. Why not take that extra step?
Well, first of all, people still need to go, obviously, to the supermarkets and to the pharmacies and a variety of other places like that. We do need to have a program in place, as I said in my remarks, to make sure that the sort of basic necessity requirements for a lot of the kids who rely on and depend on school for a big part of their sustenance every single day continue to access and get it. One of the other things we're going to be doing, and we spent a lot of time, the Lieutenant Governor and I, talking to the folks at MEMA about this, is we're going to have to come up with strategies and approaches to ensure that as this plays out and as people are displaced and as lives change and they're no longer able to work either because their employer isn't open or there are other issues associated with that, we're going to have to come up with strategies to make sure that through MEMA and its connections to the cities and towns that we're staying close to these people and ensuring that we make sure they can stay in their apartment, stay in their home, have access to food. A complete shutdown, especially for a lot of the folks who can't do the shopping associated with buying 3 months worth of stuff, would put them in a terrible position. I think what we're trying to say here is put the schools aside for 3 weeks, encourage people to treat that seriously, change the nature of the way we handle what we would describe as non-essential activities, and then work real hard with the data and with the folks at the Department of Public Health and our colleagues in the healthcare community to ensure we have the right capacity to deal with this as we ramp up our testing, as we continue to discover where people are infected and why, and make sure that we have the healthcare delivery system in a place where it can respond to it.
Are you aware if the courts are going to remain open? Courts for...
I haven't talked to the... Did you talk to the courts? I haven't talked to the courts today. Have you talked to the courts?
Not
Okay.
Would you recommend anything to them?
We talked to them quite a bit about this stuff, but I do want to let them speak for themselves.
Does the limit of 25 people or fewer apply to grocery stores and pharmacies as well?
It doesn't apply to grocery stores and pharmacies, but I mean, those are crucial places, but we certainly expect them to follow the guidance with respect to social distancing.
And with regard to schools, are there any plans for MCAS?
We think we are going to, Jim and Jim Pizer, who's the secretary, and Jeff Riley, who's the commissioner, we've talked about this. We will probably file legislation. We're not filing it tomorrow because we need to talk to some people. But on both the school improvement plans and the district improvement plans, which I think are due at the end of this month? April 1. Kind of the end of the month. The stuff that's due at the end of the month around the district improvement plans and MCAS are both, we're going to have to file legislation on both of those. Yeah.
To possibly delay it or
Yep.
something? And what about for service sector employees, people who work at bars and restaurants, may be concerned right now about how they're going to be able to, pay their bills or earn their livelihood? Are there any services that will be available to them?
That's a big part of why we're going to try and change some of the statutes and issue some emergency regs around how UI works, and it's also why we're going to try and stand up a much more aggressive approach through MEMA to supporting our colleagues in local government, who usually the first place people go when they run into trouble and concerns at home, and that's...
Governor, just to
So the
clarify.
tax filing deadline? Any thoughts?
That one's on the radar too.
Okay.
Yep.
Heard anything federally from the White House?
No.
Last question,
What do you hear
limit
from
on
the Department
gatherings.
of Corrections, the jails and prisons? How are they handling this? What are you doing?
They're being incredibly aggressive about cleaning, swiping, disinfectant, all that stuff, and we'll continue to do that. I think in some respects, their population in particular needs them, and the population themselves needs to be incredibly aggressive, both on the correctional side and on the inmate side, with respect to all these rules around distancing and especially around disinfecting and swiping and wiping. Yeah.
Are you concerned that the lack of personal visits from family and friends might create pressure within the prison itself?
Yeah, we've talked a lot with both Secretary Turco and Commissioner Michi, and they have had lots of conversations with the folks in the legal community and with legislators who are particularly interested in those issues. I think what we have to do at this point is put the public health piece at the top of the pile and then try and figure out how to create opportunities to mitigate some of that as we go. But we got to start with where we are on the other populations we consider to be most at risk, which is to really limit the opportunities that they might have to get this, because in some respects, they're some of the folks that are most at risk.
Governor, did you say the limit on gatherings ends April 17th, or is there not?
April 7th. Is that why you looked over? Okay.
Yeah, I did.
Pardon me.
Was for school, is that also for the gatherings?
Yeah.
Got it.
Sorry.
Thanks, everybody.
Okay. I feel fine, but I would just say that I think we all have a tremendous amount of work to do. And I said to somebody earlier that it was 10 days ago that I got my head shaved at Granite Telecommunications. And that feels like for charity. And we raised $7 million for cancer research. And that honestly feels like a million years ago. And I think one of the great challenges we're all going to have over the course of the next few months is to recognize and understand that what we do every day is going to have a big impact, not just on what happens to us, but what happens to those people that we come in contact with. And we need to treat this and recognize that this is not a sprint. This is going to be a marathon.
Thank you.
Thank you.